everyone. I'm Haytham Hamid. I'm one of the consultant vascular and endovascular surgeons at Sunderland Royal Hospital, which is the hub site for the vascular service in South Tyneside, Sunderland Royal Hospital, Sunderland Foundation Trust, and County Durham as well. We cover South Tyneside Hospital, Sunderland Royal University Hospital of North Durham, and Bishop Auckland Hospital. And welcome to C3. This is our newly renovated hybrid operating room or vascular theatre, which is located in Sunderland Royal Hospital. And you can see it's a very spacious room which is equipped with the new ALIA system or hybrid operating system from GE. This is a state-of-the-art theatre. Not a lot in the country that have the same service, and you could see you got the operating table here and the CR machine that comes across, and you can rotate all around the table. You got controls for the operator on here, and the touch screen, and they get regular updates like anything modern these days. And as you can see, there are two big screens that shows X-ray and what we're doing, and shows us where we are in the body. This system is equipped with a very good or an excellent fusion system, where it basically takes a CT scan, reconstructed, and kind of a cheating thing that shows you where you are in the body. And not a long time ago, where we used to use only 15-inch screens to see, but now with these big screens you can zoom up, see as big as you want, and that really helps us to do more complex operating cases in this theatre. And in addition to these bigger screens, you've got other smaller screens for radiographers and anyone in the room to have a look. And if you look carefully at the screen as well, yes, you expect to have a big X-ray here when the patient arrives, but there are a lot of information that you can find on the screen as well, and that give you an up-to-date or live information about the X-ray dose that you're using, and whether you need to reduce your X-ray or not, for obviously for patient safety and for the staff safety as well. If you look around in the room as well, you can see the anesthetic machine, you can see the CR research, extra kit of equipment that we can use as well, where you can see the ultrasound, normal ultrasound, and the intravascular ultrasound there. At the back of the screen as well, there's an extra controls for the radiographer, and here on the table with an injection machine or injector that he used to inject contrast or dye on the patient. Obviously, there are a lot of things which are standard in theatres, which are, for example, the lights, but also other protective shields for the operators, because obviously we use X-ray here, and we want to be as safe as possible for our staff and our patients.
So what makes this version of our vascular theatre better than the old version we had?
The old version that we had was more than 7-year-old, and obviously with any upgrades in technology that we didn't have at the time, but this machine will incorporate up-to-date technologies in vascular surgery, which enable us to do more complex operations. The field that you can screen is bigger, the technology that you're using is better, the dose of radiation that you need to do a certain procedure is better with this technology, and obviously the fusion system as well, which I mentioned about earlier, it's just better than before and makes it easier to use, user-friendly, and any surgeon realistically can do that in a short time before any procedure.